If you're searching or researching for home care costs in Los Angeles County, you're not alone, and you deserve real numbers, not vague estimates. In the next few minutes, I'm going to explain exactly what home care costs here in Los Angeles are, what affects the price, and how families can plan without being surprised. Home care is one of the most common services families in Los Angeles County explore after a hospital stay, a fall, or after a rehab center, when daily tasks for the loved ones start becoming difficult. Yet, costs, naturally, of course, in 2026 is often the biggest concern and also the most confusing part. Families are asking, how much does home care actually cost in LA County? Why do rates vary so much? What services are included? And how do we budget realistically? Today, I'm going to walk through current home care costs in Los Angeles County in early 2026, what impacts pricing, and how to think about affordability without compromising the safety of your loved one. First, it's important to clarify what we mean by home care. In Los Angeles County, home care typically refers to non-medical in-home assistance, such as bathing, dressing, and toileting, helping with walking and transfers, moving to different locations, meal preparation, medication reminders, light housekeeping, companionship, and supervision. This is different from home health care, which involves nurses and therapists and is usually covered by Medicare for short periods or other types of insurance. Today's focus is private pay non-medical home care. All right, so you're probably wondering, okay, let's get to the point. What's the current cost? So currently, market conditions, the average hourly cost of home care in Los Angeles County ranges anywhere from, I'd say, $30 to $40 per hour. The exact rate depends on several factors, which we'll cover shortly. But to help families visualize cost, let's say you have 20 hours a week of home care, approximately that's $2,600, $2,600 to $3,200 per month. If you're doing full-time, 40 hours per week, that goes to approximately over $5,000 to $6,500 a month. And if you're doing 24-hour care with high acuity, you can go anywhere from $18,000 to $25,000 a month. The reality is these numbers reflect the reality of providing licensed, insured, and legally compliant care in California. Los Angeles County has higher home care costs than many other regions due to several factors. Number one, California labor laws and overtime requirements. There are competitive caregiver wages in high-cost areas, particularly for great caregivers. Payroll taxes, workers' compensation, and insurance of the agency. Training, supervision, background checks. There's some overhead around that. Make sure there's quality with agencies. And of course, naturally, the rising cost of living across Southern California. When families compare pricing, it's important to understand that lower rates may reflect shortcuts in compliance and caregiver support. So just keep that in mind. Several factors also influence your specific home care cost. The hours of care is needed. If short shifts often cost more than longer consistent shifts. The level of assistance required. If there's dementia care, if there's mobility assistance, if there's high fall risk, that may affect pricing. Scheduling of consistency. If there's regular weekly schedules, it's more cost effective than frequent last minute changes. Location within LA County itself. Rates may vary between just even frankly different cities, from Long Beach to San Pedro, to the west side, to South LA, or even San Fernando Valley. And then lastly, the time of care. Sometimes if it's nights, weekends, or holidays, that may dictate various different rates. Many families will compare home care costs to assisted living or skilled nursing facilities. Some key considerations to consider. Assisted living in LA County often ranges from $4,500 to I've seen well over $10,000 a month. Skilled nursing facilities can easily exceed $10,000 per month. Home care, on the other hand, offers flexibility where families pay only for the care needed. For many families, part-time home care is a cost-effective way to delay or avoid facility placement as long as possible. Does insurance cover home care in LA County? Most non-medical home care is private pay. However, families can also explore long-term care insurance, VA benefits for eligible veterans to get free home care, and limited Medi-Cal programs like IHSS, as well as the CalAID program. Medicare, on the other hand, generally does not cover ongoing personal care services. Understanding this early helps families plan realistically. Families, I find, often in Los Angeles County, reduce costs by starting with a few hours or increasing as needed, focus care during high-risk times of the day, so not throughout the day, family members combining family support with professional care that will reduce hours, and then planning schedules consistently for the loved one. Home care is best when it's proactive, not crisis-driven, so plan that out, that schedule. Home care costs in LA County can feel overwhelming, and I know it can be a lot, but understanding numbers brings clarity and control, and you could plan for that. Now, the goal, keep in mind, is not just affordability, but it's the best care for your loved one that includes safety, dignity, and stability at home. If your family is exploring home care in Los Angeles County, ask questions, compare responsibility, and work with professionals who are transparent around their pricing, their expectations, as well as their legal compliance. If this video helped, please like, subscribe, and share it with someone navigating care decisions, because informed families make better choices.